In this tutorial, we're going to be looking at 12 reasons why you need to stop doing the stretching of the hamstrings and the stretching of the lower back to help your lower back pain. So what I'm going to do first is quickly show you the two stretches, and then we're going to work through one stretch at a time and each of the reasons why you need to stop doing it, and then we'll sort of summarize it at the end as well. So stretch number one, you may find people doing that sort of knees to chest type of position. So coming into this sort of position, or it may even be sort of going from side to side, but mainly that knees to chest position. So that's going to be stretch number one that we're going to look at. And then stretch number two is a hamstring stretch. So now that could be, anything from this type of position all the way into this type of position. So if you are looking to overcome lower back pain, those are the two stretches to remove. And what we're going to talk about next is why. The first stretch we're looking at is the knees to chest stretch. Now, reason one why this is worth removing is range of movement at the spine or tightness within the spine isn't an indicator for spine health. And what it can actually do is create instability within the area, which is then just going to, in some respects, continue repeating the problem. So what does that basically mean? Well, as you stretch a muscle, the area can become more unstable because the tightness is the body's, let's just say, default way of creating stability. So if there is instability through the pelvis or through the spine, it will tighten the area up. So if you then go about stretching that area, but not addressing the stability of the area, it's going to create that tightness again. So you're then just caught in what is a sort of a vicious cycle of releasing the tension, and then the body creates it again, releasing the tension, creates it again. So you're not really correcting the problem. Reason number two is flexion intolerant spines won't like it. So what that basically means is if you get pain whilst you're sat down, if you get pain whilst you do sit-ups, if you get pain whilst you're in this flexed posture, that is the trigger of your pain. So if you then go into the knees to chest stretch, you're essentially creating that flexed spine. So when you come down, as you pull the knees to the chest, you're lifting your hips, which is creating that rounded posture, which is essentially triggering the pain. So not only have you got range of movement as an indicator, you could potentially be triggering the problem by recreating the mechanics that cause your lower back pain. The flexion that comes from the knees to chest stretch, or as I showed you before, the slightly sort of rocking of the knees, that rotation can actually inhibit and create unhealthy discs. So it can do what's called delaminate the discs, which is then helps the annulus move through. Now, that isn't something that you're going to feel in the moment, but it can be happening to you over time, and then in one moment where you go to lift something or pick something up from the floor, the back goes. So it's the straw that broke the camel's back. So that position isn't creating healthy discs, it's not creating a healthy spine, because not only is range of movement not a good indicator, the flexion and the rotation are also potential mechanisms for causing the problem. The fourth and final reason for this stretch is if we are stretching spinal ligaments, that can actually create more instability in the area, which can then instigate muscle spasms. So there's a number of ways muscle spasms can occur, but generally it's there to stabilize instability. So the muscle will be tensioning and becoming more tense and tight to stabilize the area. And that can be because there's a nerve, the disc is touching the nerve is being compressed upon, or there is instability within the segments, which is coming from laxity through other tissues like ligaments. Stretch number two was the hamstring stretch. And as I mentioned, it was, this type of stretch, or even sat down and reaching one leg or even both legs, or even just going down, touching your toes like that as well can be another stretch to avoid. So, why? Number one, if you are an athlete that sprints, runs, jumps, anything like that, as a general rule, you are using your hamstrings as a spring, which is creating more explosive power. So by stretching out that spring, it's not able to create the power that it once could. So if you have a back problem, hamstrings generally are a symptom of it rather than a cause of it. But even if you have no pain and you've got tight hamstrings, it's useful to avoid because it's actually helping you with your athletic performance by using it as a spring. Number 2 is hip flexion, which is the sort of the toe coming towards the head, which is essentially what you're doing in any sort of hamstring stretch, be it down on the floor or in a standing position. That hip flexion isn't a good indicator for back pain, whereas external and internal rotation is a much better one. So that doesn't involve any hamstrings. That involves glute medius, glute minimus, tensor fasciae lata, adductors, so on and so forth. So all these different muscles, psoas as well, all of those muscles are involved in hip internal and external rotation. So it's much more effective to focus on the rotation of the hip rather than the flexion of the hip. I touched on this before, but the increased range of movement of the spine isn't a good indicator of spine health and back health. What is actually more effective is just to have adequate range of movement. So when we are stretching, we aren't looking to get to some pre-prescribed level. We need to look at the function of the individual, the potential sport the individual's playing, and the necessary range of movement that is needed for that. If we aren't fitting to that, then it could be useful to start elongating hamstrings or lower back. Number 4 is that tight hamstrings actually help stabilize the knee as well. So if we have got back pain, then stretching the hamstring isn't that effective. If that has then moved down the chain into the knee, then again, tight hamstrings are there to help and create shear stability for the knee, to stop any sliding movement. Because as I mentioned before, the most sort of primitive and primary reason the body creates tightness is for stability and to create a more stable area. It's not the most effective way of creating stability, but it is the body's most primary sort of fight or flight mechanism to be able to do it when it's not being trained in a proper way to be able to do that. So again, stretching hamstrings isn't that effective for not only lower back pain, but also if you have any knee problems. And number 5, hamstring tension can be related to the pain that you're experiencing. So as pain comes on, the tension in hamstrings can also become more. And then as the pain reduces in the back, the slackness in the hamstrings can also relax. So it may be something that you're missing because you're not essentially thinking about your hamstrings when you don't have any back pain. Or a clinician or a therapist is only testing your hamstrings when you have back pain, which is when they're going to be potentially at their tightest to create stability through the pelvis to impact on the spine. So there may well be a difference between the two. So it's very much thinking about hamstrings aren't the cause of back pain. They are much more a symptom of the cause. So we need to go about thinking, how can we manage the cause rather than how can we treat the symptoms? Now to look at some reasons for both of the stretches. So we're kind of generalizing and summarizing what we've been talking about. And number 1 is, as I've mentioned a few times, is tightness is generally not a cause of back pain. It's generally a symptom of back pain. So it's being able to understand that. So if we can understand that, we can find the cause. We're then going to be treating lower back pain much more effectively than just using these sort of generalized, standardized stretches, which aren't that effective at treating the actual cause, but more so just to overcome some localized symptoms. Number 2, what you're doing is you're activating what's called a stretch reflex. So you get a short-term relief, but then as I've mentioned, what the body will do is it will reflex back into tension. So again, you're in that sort of vicious cycle of always being tight, because again, it's because of the symptom that the tightness is there. You then stretch the tightness out and you feel relief, and then generally it will come back tight, if not tighter than it was before. And finally, number 3, mobility is a requirement. So to have mobility of the spine and mobility of the hips is a requirement. But what we have to understand is what I've discussed all the way through, is that a loose joint is an unstable joint. So what the body will do if it is just loose is it will become unstable, and then the body will then react to that and create tightness. So what we really have to do is not only create the adequate range of movement that we need, but then to put stability in its place using exercise or using stretching and exercise to put stability in its place, so we can then go about managing the tightness and aiding the overcoming of lower back pain. Many thanks for watching. My name is Chris from Christopher Holt Training. If you found this video useful and you want to help, or you want me to help you overcome your lower back pain, then please do just click the link below. You'll go through to the rehab package, which is pre-consultation and questionnaires. You've got a 45-minute consultation plus 2 weeks of support with all the advice, recommendations and the answering of questions and queries using the 2 weeks of support that happen after the consultation. So if that's something that you think will help overcome your lower back pain, then please do just get in touch using the link below.